Good evening, Deep, and welcome again to the Digital Excellence Pharma Academy. I hope you had a splendid week. We had a wonderful session by Rita Chandrachud in our Women Leaders in Healthcare series. And it was wonderful to get perspectives from somebody sitting all the way in New Jersey and shows her fondness for Indian pharma and to continue her contribution to the development of women leaders and leaders as a whole. So that is something really admirable about those who have risen from the ranks and have not forgotten, that they have a responsibility to give back to the industry. And so many of them in this leadership series, right from Sanjiv Navangul, Hariram Krishnan, Dr. Sanjay Mitra, Atish Majumdar, have so generously contributed to this. And we have also started the Women Leaders in Healthcare series, where we had Aparna Mittal talking from the patient's perspective, and that shows medicine man's commitment to patient journey. We've also had Sudeep Chakravarti talk on patient centricity as a go-to-market model, and Amlesh Ranjan bringing in a completely different perspective of what's the difference between patient centricity and being patient centered. So this has been a wonderful journey, and you have put it together very wonderfully for DEPA as a talent development module in four sections, beginning with the leadership. And this is our third in the series where we will be discussing about the leadership imperatives in the COVID-19 crisis and going forward. So, your thoughts, Deep, as we begin to discuss what are the key learnings from Sanjeev Navangul's session.
Thanks, Arup, and good evening, ladies and gentlemen, and welcome to this wonderful conversation with Anup. First of all, I think that Rita Chandrachud's session was really, really insightful. I think that she has packed very powerful, actionable insights, and I think that compliments to you to starting that women in leadership role in pharma. I think that's something that is very interesting. You asked about Sanjeev Navangul. He brings wonderful insights from his past experiences. He's talking about how he has experienced managing and then building that into a concept and bringing that. I think that Sanjeev Navangul's talk was very interesting because it's based on very concrete experience. I think that audience can relate because they can see that it's actionable, it's doable, and something that people have benefited. And then he also has a wonderful insight of connecting the dots. So it's a very fascinating to listen to Sanjeev Navalkar.
Great. So you have been a leader yourself in the pharma industry for many, many years with Novartis and then with UCV Pharma. So let me start with a bouncer and have your take on why is it so difficult for pharma leaders to shift their focus to accelerate digital adoption, and the following question as to what can pharma leaders to do to develop new skills and ways of thinking to facilitate digital adoption.
I don't think there is any other career transition which is more difficult than leading an organization in the current context. And I think that it's much more complex, and understandably, the most leaders tend to feel overwhelmed. To succeed, they need to shift their focus and develop new skills, of course. But more importantly, they need to look at maybe a brand new way of thinking. If you can see this slide, we are going to spend little bit time on looking at how do you have traditional leaders, and I'm not saying that traditional in a traditional way, but then you can say that currently, and then how do you have leaders for any future. Okay, so these are seven transitions or seven shifts or major transition that navigates leaders to become ready for any future. Okay, so a thorough understanding of each of these transition possibly can help prepare the leaders for success. Now let's look at the bottom and talk about the first and possibly the most common trap Most leaders find it difficult shifting from being a specialist, whether they are from a finance function, where they are from a marketing function or supply chain or sales, to a journalist, which means that they have a very difficult urge to stay in their comfort zone, in the warmth of their specialized area. So you will understand that you need to deal with the different cultures or subcultures, mental models, language of all different functions, and become familiar with the various tools they use to solve the business problem. So there are various things which you look at in areas where you don't have expertise. You will need to learn what question to ask, what metrics to use, and how to evaluate, and what are the people you can rely on to do that. Many examples are coming to my mind, and one such example was that the boss I worked with, he came from a very strong sales background, and I was head of sales at that point of time. And then, I realized that the kind of time that he's spending on sales issues is phenomenal. All right. And what happened because of that is that, the other functions, they find it very difficult to deal with that. So that's something that one need to be very conscious about. The second transition is also quite similar to what we call from analyst to an integrator. And I think that that's the leader's primary responsibility: get the people, manage people who can focus on analytical depth and the specific business activities. And when we talk about that leaders for any future, their job is to integrate collective knowledge of functions, problems at hand, or the organizational problems. So take, for example, that if you have a digital initiative, right? You have a challenge that in many organizations, there's a very specific function or those who handle those digital initiatives. In many organizations, that even the marketing don't know what the digital team is doing, and they're not aware. And I think that that's where you see that a leader can make a big difference, how he can or she can integrate the knowledge. Third shift, which is again very common, is from tactician to a strategist. And many leaders focus on tactical issues because it's seductive. The activities are concrete, they give you immediate results and they give you immediate kick, and it's tempting to leaders to lose themselves on day-to-day flow of attending meeting, putting out fires, pushing projects over the finish line and things like that. But I think that leaders find it very difficult to let go. So changing requires that they need to adopt a broader mindset. So there are three key skills when we talk about that transitioning from tactician to strategist, and what we call very basic label shifting, which means that you need to evaluate when to focus on details and when to focus on big picture, and how do you relate these two together. The other is pattern recognition. How do you identify that important causal relationship in this complex environment? So it was very common what you say, separating signal from the noise. Third is equally very important, is the mental simulation, which means broadly, if you look at that, how do you anticipate how the environmental changes, competition, regulators, various social media will respond to what you're doing, right? And hence that you are prepared for that. So I think that that's where many leaders have a challenge in this. If you look at that next shift, you see that the very common challenge again is that shift from what we call it as a bricklayer to architect. And I think that most people trip over this. So leaders tend to charge in, itching to make their mark. They might have a high stakes or shake things up, right? And you know, and If you relate with that digital initiative, now most leaders, they want to do something in this area, isn't it?
Right.
And what they do is that they really take this up, and I think that they start doing something immediately. And I think that this is pretty evident if you look at that in early April or May. Many of the organizations, they started doing something because it was very difficult to engage customer in a meaningful conversation and things like that without really understanding how the business strategy, structure, processes, and capabilities fit together. So they're looking at doing something without really thinking in terms of the system and the expression, the bricklayer to the architect. I have spoken with many people and they say that it doesn't work, that we tried, but it doesn't work. Customers are not ready for it and they are not accepting it. And I think that let's switch back to more reliable system, which we know what it is and we are expert in that, and that's what it is, without really understanding where they have made the mistake. And if you move forward, you find that many managers from the perspective, what we call problem solver to a agenda setter, right? And this has a very unique perspective because many leaders are promoted because they have the ability to solve problems. And when they become leader, they still rely on what they know best. Take, for example, technology or digital. So if you look at that, how do you really set the agenda for the organization? Rather, they look at the specific challenge and get into that. The leader for any future should move from or shift from being a problem solver to a agenda setter, largely a matter of learning from the experience. The next shift is warrior to diplomat, which means that you spend much less time marshaling the troops, but time to engaging and influencing a full range of stakeholders. Again, if I get back to same example of digital adoption, you will find that we see not all function in the organization see a common thread or common agenda or compelling vision. We see that this is something spearheaded by only a select group of people, not across the organization. So you see different pieces of the organization pulling in a different direction. That's where we see a big challenge. Finally, I think that it's important that when you look at how do you see yourself in terms of what role you play. Are you a supporting cast or you are in a lead role? And lead role means that you take broadly your role to drive inspiration, setting the vision, the right behaviors, right attitude, role modeling, right? Are you driver of a particular initiative? So that's where these are very critical to how the leader should cultivate themselves, requires a high level of self-awareness, and more importantly, that they also need empathy. How do you look at the other people's viewpoint? So, if you look at that, these are the 7 shifts which are important to navigate from a traditional leader to possibly leader prepared for any future. So, that's what I thought might interest our audience to look at these shifts.
Great, Deep. Wonderful. I think you have hit my bouncer straight for a sixer, or should I say a sevener? So you have more than answered my questions. I think now it's very clear as to why, not just for pharma leaders, probably even if you're a leader in your own home. I always said that a handsome guy doesn't may make a great lover, but not a great husband or a great father. Because I think you remain in your core competence of being handsome and the ability to be a ladies' man, and that continues. And that probably could be setting up for a failure as in the future role as a husband and father. So great seven shifts that you have talked about, Deep. And I think I will just quickly sum it up as that, we begin our career as specialists, and that could be in sales and that could be in marketing. But as we grow in your career, that the very specialist ability that made us successful in that role can become a liability, because we now have to lead a whole lot of other specialists as well, which could be analysts, which could be tacticians, which could be problem solvers, and so many other roles. And we can continue to remain to play our comfort zone roles, and thus bring about probably a difficulty in leading other things. So I think it's a fabulous explanation that you have given, how the seven transitions that leaders need to make to be able to lead in the future. So I particularly like this bricklayer to architect, because in my sessions for sales leaders, I used to tell them the story of the owner of a construction company disguising himself and going to his construction site where his people are working. And he wants to interview a person for the role of a leader. So they're all bricklayers. And so he goes and asks the first one, what are you doing? And so he says, what do you mean what I'm doing? Can't you see what I'm doing? I'm toiling in the hot sun and I'm laying bricks. So he says, fine. And he moves to the next one. He's also laying bricks, and he asks him, what are you doing? And he says, well, I'm building a wall, he says. So same task, but a slightly different perspective he has. And finally goes to a third person and asks him, what are you doing? And he says, I'm building a cathedral. So he says, wow, this is the perspective that I need my future leaders to have, is the perspective that, not an obsession with their roles, but being able to see the big picture, and have that vision that I'm building a cathedral or a temple, or whatever you want to call it.
Wonderful. I think that's a very inspiring story, and that's all about leadership. And now, issue is that many times it's not the intellectually leaders are not aware of this, but then they have their default mode. So they, by their habit, they find it easy, and that's a comfort zone. They move back to that role which they have been so successful in their career and lives, and which has given them this opportunity as a leader, rather than transitioning into preparing themselves for leaders for any future.
Great. And I think you have brought it out very well in framing the architecture to develop pharma business leaders for today and tomorrow. And you have structured it so well to build the new breed of effective pharma leaders into four modules, beginning with leadership, going on to digital, then sales and sales management, and customer and patient centricity. So this is on offer for all the pharma professionals, so that they can use this platform to develop the capabilities that they require to be able to successfully navigate this transition. And as I said earlier, we have had a fantastic spectrum of leaders, and all these webinars by these leaders are available for people to view at any point of their convenience. And finally, coming to the Medicine Man 70-20-10 approach to build digital competencies, while the 10% is available through these sessions and 20% through the interaction with your team members and others in the forum on Digital Excellence Pharma Academy. The majority of it, or I would say 70% of it, as you said, is coming from experiential learning. So it is essential for you to do a pilot, not with the objective of succeeding or failing, but with the objective of experimenting and learning, so that we can move forward. So structured learning, learning from others, and learning from experience as the most powerful way of really bridging the gap, as you said in your earlier session, between knowing and doing. So I think even when it comes to leaders, everybody knows what it is to be a leader, but then to be a leader is a whole new ball game altogether. And I think there are some key takeaways from Sanjiv Navangul's session. So would be wonderful, Deep, if you could talk a little bit on the key learnings from Sanjiv Navangul's session.
I really love the way that Sanjiv Navangul shared actionable insight. Why I say actionable insight? Because it's all based on his concrete experience. He has done that. He has given examples which he has done, say, 10 years back. And he said that how simple intervention using a technology can change the very difficult business problem. You talk about the PD bags in dialysis is used where the nursing assistance is required, and they find that 100 nurses and they wanted another 25% more. And they say that if we have a call center, possibly that will have a much better patient service. Very, very simple, practical approaches and things like that. And that's where staying ahead of the curve really helps you. So his talk is very, very inspiring, very supporting. And I think that it makes sense to watch it again and learn and get the message.
Great, wonderful capture of those highlights from Sanjiv Navangul's session. And you can view it both on the DEPA platform as well as the newly started Medicine Man YouTube channel. So as you rightly said, the key takeaways were he said embrace technology early rather than late and look at it as a learning experience and the interface with technology. So he said it's not just digital, but any technology, like he talked about the call center experience that he had. And these experiences build our confidence. And also, he said that especially launching new products using digital would be a wonderful occasion, an opportunity to learn. And he also gave another perspective of go to patients rather than go to market as a strategy and mapping the stakeholders right from the time they experience the discomfort till the time they come to doctors and compliance and the outcomes that they experience as being more important than the product and the promotions that we are doing. Great, Deep. It's been wonderful talking to you. What else have you in store for us going forwards?
Well, I think that it's important that we revisit moving forward one by one our lessons. We had wonderful experience, nearly 20 of them. We have a great insight, each one of them shared. And every time I watch them, I get a little additional perspective, some wisdom from their experiences and things like that. So, what we are going to do is revisit one by one each of these four sessions. We are talking about leadership, we move to digital, we'll move to sales and sales management, and finally, we move to customer and patient centricity. So one by one, we intend to visit and then possibly see how best we all can learn together from each other's experiences from those wonderful leaders, those who shared their own experiences.
Great. And you also said that how these four, that is leadership, digital, sales, and customer and patient centricity, don't exist in isolation as silos, but they are all interwoven and integrated. And it makes so much more sense now that you brought the seven transitions where the leader plays the lead role as an integrator of all these things. And therefore, it is so nice that you could put it all together and bring these perspectives so that leaders can really understand what is their role in integrating these four elements that are required going forwards to succeed in the pharma world. Thank you, Deep. It's been a great learning session as always from you, and look forward to seeing you again next Saturday with some more learning.
Thank you very much and truly enjoyed that. Have a wonderful evening ahead.